Yeah, some children go for therapy for months, even after years, but speech still don't come out. So the problem in most cases is not the therapy itself. You find the problem is the root cause is not being addressed. Because for a child to speak, 4 things have to be involved. There is brain, there's nervous system, coordination, and body control. Those things have to work together so that your child can speak. And also, there are 3 main things that also hinder speech. And in most cases, you find they constitute like 90% of the reasons why the children have been undergoing therapy, but still they are not getting results. First of all, it's asking the child to repeat words. So when if you ask in some therapies, you find the child is being asked to repeat words, yet the body and brain are not coordinated. So no matter how many times you ask the child to say mommy, say daddy, say this, say that, say this, and his body and brain are not coordinated, the mouth, the jaw, and the lips will not receive instructions. If they are not responding well to instructions to speak, he may repeat what you are asking him to repeat. And instead of using the normal parts of the brain involved in speech, like motor cortex, in giving commands to the mouth and the lips and jaw to speak, like motor cortex, basal ganglia, and the cerebellum, even brainstem sometimes, in some cases, children either may get frustrated and start avoiding you, or even feel completely not into what you are trying to make him repeat. And instead you find now he's trying to imitate. So when he imitates, he's not using the same path, the same part of the brain that we use to speak. The part which will not be working is the right hemisphere. The right hemisphere is where our brain record patterns. So when it records patterns like songs, you find the child can say mommy. You say mommy, yes, mama. Say daddy, say dada. Say baby, say baba. So he will speak it not using the same parts of the brain that are supposed to be helping him to speak, and then instead he will use the right hemisphere or rhythm pathways. So when he used that, still you will not be able to achieve that result. So another 3 reasons why children you find are not speaking. There is first, asking the child to repeat, forgetting that maybe the biggest problem he has, the body and brain are not coordinated, are not communicating very well. Another thing that also you find is hindering children from speech is inconsistency. In most cases, you find parents are doing therapy like once a month. So if you do therapy and once a month, the brain may not be able to make speech because, first of all, there is inconsistency, and our brain to make speech and speak, or even to be trained in anything, because speaking is a skill that uses movement of the body to speak, like mouth, jaw, and lips. So it needs repetition and structure. So that is also another second reason that your child might not be able to speak. Not because the therapy, but also because there is no consistency. Another thing is also irregulation. It will be very difficult for you as a speech therapist or a caregiver to train a child to speak who can't settle, who can't focus, who is distracted. So you find because children are not settled, it becomes very difficult to train that child to speak. So what can you do as a parent? Of course, you can bring your child for Kunga therapy, whereby Kunga therapy will help you with Kunga therapy, the child will gain attention. The child will gain eye contact. The child will gain, the different parts of the brain will start connecting because of enough blood supply. And also that body-brain coordination, Kunga therapy is able to improve that. So when that is improved, now as speech therapists will find it easier to train the child to speak because the child is now focused, the child is attentive, and his body and brain and the body and brain are now coordinated. The mouth, the jaw, and the lips are receiving instruction very well. They are responding, and also the instructions that are coming are very good. So it will be very difficult, very easier now to train the child to speak. And in most cases, actually, after getting Kunga therapy, children now start speaking naturally because the body and brain are communicating very well. The body is responding to instruction very well. The brain is also sending clear signals. So that becomes easier for the whole thing, even for you as a parent at home. It becomes easier for you to engage your child to talk because now he's stable, he's focused, he has eye contact. He doesn't have overstimulated nervous system. His nervous system is calm. It will become very easier now to train the child to speak.